Checking for infections. Men and women can contract and spread sexually transmitted infections. They do this through unprotected vaginal, anal, or oral sex, or just close genital contact with male or female partners. Some STIs can be transmitted via infected blood, saliva, or from mother to baby. STIs may produce no symptoms, so it is sensible to have an STI check before starting a sexual relationship to reduce the risk of infecting others. Some viral infections can be detected by blood tests. At the time of infection, HIV may cause a flu-like illness, but 1 in 5 people develop no symptoms. HIV is detected with a blood test for antibodies raised by the body against the virus. Antibodies can take 3 months to multiply sufficiently to give a positive result. So the best HIV tests look for antigens, traces of the virus itself as well, which can be detected 4 weeks after infection. If using point-of-care testing at a sexual health clinic, for instance, results can be produced from a pinprick blood sample on site within a few minutes. In some clinics, you might be asked to provide saliva. A second test to confirm the results is strongly recommended. Hepatitis C is also often asymptomatic. Blood tests look for antibodies, but in this case, antibodies can only show that the body has been exposed to the virus. It may since have fought the virus off. To confirm you are infected and infectious, more precise tests are needed that detect the viral RNA, the genetic material. More than 1 million sexually transmitted infections are acquired every day worldwide. If you suspect you have an STI, a clinician will ask you about your sexual history as part of the testing procedure. You might be asked when you last had sex and if you used a condom. So the viral infections are HIV, hepatitis B, C, genital warts, genital herpes, while bacterial would be syphilis, gonorrhea, chlamydia, non-gonococcal urethritis, and we have trichomoniasis, which is a protozoan parasite, and pubic lice, which is an animal parasite. All of these infections, the viral and bacterial, can produce symptoms in some cases, but any of them can also be completely asymptomatic, particularly in the early stages. Bacterial infections, such as chlamydia and gonorrhea, can be detected in urine or in swabs from the urethra. In the case of urine, you will be asked to wait for at least 2 hours since you last urinated before passing a urine sample. The first part of the urine stream should be caught in a sterile container. This is because by the end of urination, vital telltale bacteria might have been washed away. The urethral swab test. The healthcare professional may want to take a swab. A small cotton-tipped swab is inserted directly into the urethra to collect any bacteria there. A swab can also be used to collect a specimen from your anus, throat, or eyes. Home testing and home sampling HIV kits are available and legal in some countries. Most of them use a pinprick blood sample and/or a urine sample. You can sometimes do postal testing too. Discuss with your doctor having the hepatitis B vaccine and practice safer sex. Thank you for your attention. Pathology of GH mechanism, kidneys, bladder, small intestine, large intestine. Kidney qi descends to the bladder to promote urination. In pathology, if kidney qi fails to descend towards the bladder, there may be urinary retention. When kidney qi fails to descend, it cannot grasp lung qi, and this may cause breathlessness. In other respects, the kidneys have an ascending movement insofar as kidney yang vaporizes the fluids and sends them up to the lungs. If kidney qi fails to ascend in this respect, the lungs will suffer from dryness and the person will experience a dry cough. To stimulate the descending of kidney qi, we use REN4. The qi of the bladder descends to promote excretion of urine. If the qi of the bladder fails to descend, there will be urinary retention. The qi of the small intestine descends to promote the movement of the products of digestion towards the large intestine and the fluids towards the bladder. If the qi of the small intestine fails to descend, there will be abdominal distension and pain. The qi of the large intestine descends to promote excretion of stools. If the qi of the large intestine fails to descend, there will be constipation and abdominal distension. Thank you for your attention. Let's talk about stomach 38, Chiao Ko. Stomach 38, Chiao Ko, is located on the anterolateral leg, 8 sun below stomach 35, or 8 sun above the lateral malleolus, that is, halfway between, 1 finger breadth lateral to the anterior margin of the tibia. Chiao Ko is translated as narrow opening, branch opening, or ribbon opening. Chiao, when combined with feng, wind in a classical term for the early spring wind, and suggests this point's ability to dispel wind according to the Great Compendium. Situated between the upper and lower great voids, Chiao Ko, or narrow opening, provides a connecting duct for the qi and can be used to tonify and regulate the stomach official when there is stagnation or disturbance to the flow of stomach qi. Removes obstruction from the channel and also affects the area of influence of arm yang ming, or large intestine. It is most often used as an empirical point for pain and stiffness of the shoulder joint, usually needled with dispersion, while the patient gently rotates the shoulder. Local and distal points may then be used. Indications: shoulder pain, lower leg, knee and foot pain, numbness and stiffness, dispels wind, stomach cramps. This point can be used for stagnation or blockage in the stomach meridian caused by the branch opening being closed. It is also helpful for loss of sensation in the limbs, indicating the point is closed, general weakness of the legs, or for pain and stiffness in the shoulder joint. Chiao Ko is either used as a local point in the treatment of a variety of disorders of the leg, or more commonly as an important empirical point in the treatment of shoulder disorders. For this latter use, Chiao Ko is normally needled on the affected side with the patient sitting. After qi is obtained, the patient is asked to move the shoulder around the area of pain whilst the needle is manipulated at stomach 38. In most cases, pain will be relieved and mobility increase immediately. This procedure is normally followed by needling of appropriate local and distal points. Although the ability of this point to treat shoulder disorders with great effectiveness may be partially explained by the close link between the stomach and large intestine channels, this is first and foremost an example of the empirical use of acupuncture points. Indications and potential point combinations. For pain or paralysis in the leg, stomach 38, 36, Bafung, the web spaces between the toes, identify dysfunctional nerves and spinal cord segments, bladder 23, 25, 27. For anterolateral leg pain, stomach 38, check for trigger points in the tibialis anterior and extensor digitorum longus muscles. Evidence-based applications. Electroacupuncture at stomach 38 and GB 34 provided significantly more relief for patients with tennis elbow than did manual acupuncture. Electroacupuncture at stomach 36 and 38 potentiated the hypotensive effect of nitroglycerin, which helped achieve the target mean arterial pressure during microscope middle ear surgery under general anesthesia with halothane. Thank you for your attention. Phlegm heat obstructing the lung. This is due to phlegm combined with heat obstructing the lung, which leads to impairment in dispersing and descending functions and consequently manifests as excess heat along the lung channel. Clinical manifestations: cough with profuse yellow thick sputum, chest stuffiness, dyspnea, nostrils flaring, gurgling sound in the throat, vexation and restlessness, fever, thirst, cough, and expectoration with foul smelling, pus-like sputum with blood, chest pain, constipation, scanty dark urine, red tongue with yellow greasy coating, slippery and rapid pulse. This pattern is mainly caused by pathogens invading the lung and then stagnating and subsequently turning into heat, which injures lung fluids to form phlegm. Alternatively, it can be caused by long-standing phlegm turning into heat, both of which combine together and obstruct the lung. Key symptoms: cough with profuse sputum and symptoms of interior excess heat. Phlegm heat obstructing the lung can cause failure to govern dispersing and descending and interior exuberant heat. For failure to govern dispersing and descending will cause the following: counterflow, rising of qi, resulting to cough, chest stuffiness, and dyspnea. Lung qi not moving freely will cause flaring of the nostrils. Counterflow rising of the qi combined with phlegm will lead to cough with profuse yellow thick sputum or gurgling sound in the throat. Both failure to govern dispersing and descending and interior exuberant heat will obstruct the lung networks. Qi and blood will become depleted and stagnated. Blood and mucus will be decomposed, leading to cough and expectoration with foul-smelling sputum with pus and blood. Interior exuberant heat causes steaming upward, leading to fever, disturbing of the mind, causing vexation and restlessness, and injuring the fluids, leading to thirst, constipation, and dark yellow urine. So let's differentiate the following patterns: wind heat invading the lung pattern, lung dryness, heat pathogen congesting the lung, and phlegm heat obstructing the lung. Wind heat invading the lung is common in winter and spring, leading to cough with yellow sticky sputum, with secondary symptoms: stuffy nose with yellow thick discharge, fever, aversion to wind, dry mouth, sore throat. Tip of the tongue is red with thin yellow coating, with floating and rapid pulse. For lung dryness, this is common during autumn and winter. Main symptoms are dry cough with scanty sticky sputum, dry lips, tongue, pharynx, and nose. And secondary symptoms are aversion to cold and fever. The tongue is red with white or thin yellow coating, with floating and rapid or tense pulse. For heat pathogen congesting the lung, this will be common in winter and spring, leading to cough and dyspnea with scanty sputum, high fever. Secondary symptoms include thirst, vexation and restlessness, nostrils flaring, chest pain, sore throat with redness and swelling. Tongue is red with yellow coating, pulse is rapid. For phlegm heat obstructing the lung, this will be common in winter and spring, causing cough and dyspnea with profuse yellow thick sputum, cough and expectoration with foul-smelling pus-like sputum with blood, high fever. Secondary symptoms would include thirst, vexation, nostrils flaring, chest pain, chest stuffiness. Tongue is red with yellow greasy coating. Pulse would be slippery and rapid. To summarize, phlegm heat obstructing the lung will have as etiology invasion of exterior heat, depressed in the lung, transforming into heat. Internally produced heat from indeficiency or qi stagnation from long-term emotional strain. Excessive consumption of greasy and cold raw foods. Possible presenting condition: bronchial asthma, acute bronchitis, pneumonia, pulmonary emphysema with infection. Signs and symptoms: cough and panting, barking cough with profuse sticky yellow or green sputum, shortness of breath, sweating, flaring nostrils, expectoration of blood and or purulent phlegm with fishy smell, wheezing, feeling of oppression of the chest, feeling of heat, thirst, insomnia, agitation, pulse slippery, rapid, tongue red, swollen with a sticky yellow coating. Treatment principle: clear and drain phlegm heat. Okay, to clear heat and phlegm, we use lung 5 and we use lung 7 to restore lung descending function. To clear lung heat, we use lung 10 and Li 11. To supplement lung qi, we use bladder 13. To supplement the spleen, resolve phlegm, we have Ren 12. Stomach 40 to resolve phlegm. Lung 1 to descend lung qi, alleviate cough. Li 4 to release the exterior. Ren 17 unbinds the chest. Stomach 36 transforms phlegm. Kidney 6 to disinhibit the throat. We needle with drainage. Prick Li 1 to bleed. A person with phlegm heat in the lung should avoid consuming food that creates heat, dampness, and phlegm. This includes dairy products, sweets, dried fruits, sugar, alcohol, fried food, chili, pepper, garlic, chocolate, and lum. Smoking should be discouraged, and the person should avoid other forms of air pollution. Thank you for your attention. Diagnosis by visceral organs. We continue discussing the heart illnesses. Insufficiency of heart blood. If heart blood becomes insufficient, the heart loses its nourishment. Several mechanisms lead to insufficiency of heart blood. Chronic illness consumes heart blood insidiously. Insufficiency of the spleen and stomach leads to impaired digestion. These and massive blood loss can all lead to insufficiency of heart blood. Insufficiency of heart blood in turn leads to loss of nourishment for the heart and mind and reduces the filling of the blood vessels. As a result, the mind becomes agitated and the entire body suffers from inadequate nourishment. The typical syndrome of insufficiency of heart blood includes the following: palpitation of the heart or neurasthenia, insomnia with much dreaming, forgetfulness, a pale and lusterless or sallow complexion, pale lips and tongue, and a thread-like and feeble pulse. Deficiency of heart yin. Syndrome of heart yin deficiency appears when heart yin is too deficient to nourish the heart and when fire arises out of yin deficiency. Heart yin deficiency frequently results from frustration of the passion so that qi and fire become trapped in the interior, or chronic or heat illnesses injuring yin. In heart yin deficiency, the heart loses its nourishment and yin cannot properly restrain yang. In consequence, endogenous fire arises and causes restlessness and other syndrome of deficiency heat. The typical syndrome of heart yin deficiency is as follows. There are palpitation of the heart with restlessness, insomnia with much dreaming, hotness in the palms and soles, flushed cheeks, recurrent fever, and night sweat. Alternately, there are aphthous sores in the mouth and on the tongue. The tongue is red and dry, and the pulse thread-like and rapid. Blazing of heart fire. Heart fire may blaze when the passions are suppressed and transform into fire, or exogenous heat or fire is strong, or excessive dietary spices transform into heat and generate fire. Whatever its cause, the heart fire blazes and disturbs the mind and damages the blood channels, producing symptoms of heat in the mind, the tongue, and the meridians. The typical syndrome of blazing heart fire is as follows. There are restlessness with insomnia, aphthous sores in the mouth, flushed face, thirst, difficult and painful urination with yellow urine, and dry constipation. In severe cases, there may be hematemesis, epistaxis, or agitation with delirium. The tongue is red with yellow coating and the pulse is rapid. Thank you for your attention. Advanced assessment of mental health disorders, chief complaint, and history of present illness. I'm overtired and can't sleep or eat. JD is a 31-year-old female biology graduate student. She reports, I'm overtired and can't sleep or eat. Miss D has lost 15 pounds over the past month and wakes up unusually early each morning. She no longer is interested in her hobby of tennis because she feels tired most of the time. Miss D is a good student, but she has not been attending classes on a regular basis for the past month and feels guilty about this. She denies suicidal ideas because it is against her religion, but feels depressed for most of each day and says that nothing is fun. This feeling has been present for 5 to 6 weeks. She states, I would like to feel better enough to resume playing tennis and attending classes. I just have to get myself going. Maybe a vitamin would help. She provides little detail to questions and talks in mumbled tones. She denies hearing voices and blames no one but herself for this condition. Common chief complaints related to mental health disorders include such symptoms as sleep disturbances, mood, emotional alterations, weight loss or gain, cognitive difficulties, personality changes, and delusions or hallucinations. Sleep patterns provide clues to interpret mental status, and they often signal that mental health problems are present. Problems with falling asleep, staying asleep, and waking up frequently or early in the sleep cycle should be identified. Frequently, the depressed person may wake up early feeling depressed, whereas the anxious person may have difficulty falling asleep. When persons with schizophrenia or mania have problems with sleep, this may indicate that their illness is worsening. The person with post-traumatic stress disorder may not experience deep levels of sleep and thus feel chronically fatigued. Lack of sleep may affect all components of the mental status examination. Thus, it is important to ask about quantity, patterns, and quality of sleep when discussing the history of present illness. Onset. Was the onset sudden or gradual? Quality. Do you have trouble falling asleep? Do you have trouble staying asleep? Are you always tired? Are you tired even when you get a full night's sleep? Knowing the nature of the insomnia or fatigue helps narrow diagnosis. Depression may present with trouble falling asleep and always feeling fatigued. Patients with generalized anxiety disorder may be easily fatigued and may have difficulty falling asleep or staying asleep. Patients with bipolar disorder may feel as if they do not need to sleep. Duration. How long have you been experiencing this symptom? Dysthymia is a depressive disorder lasting 2 years or longer. Associated symptoms. Ask about associated symptoms, including difficulty concentrating, loss of pleasure or interest in hobbies, loss of appetite, guilt, suicidal ideation, excessive worrying or uncontrolled anxiety, elevated mood, or hyperactivity. Patients with depression may present with difficulty concentrating, disinterest in hobbies, guilt, suicidal ideation, and anorexia. Suicidal ideation should be assessed. Generalized anxiety disorder may present with difficulty concentrating and excessive worrying. Patients with bipolar disorder often experience elevated mood, grandiose ideas, and hyperactivity. Medications. Are you taking any medication? Some medications may cause sleep disturbances. Thank you for your attention.
Let's now go to acupuncture for emergencies. Let's discuss headache due to high blood pressure. Hypertension, commonly known as high blood pressure, is a chronic condition where the force exerted by the blood against the artery walls is high enough that it may eventually cause health problems, such as heart disease. The condition is typically divided into two types: primary essential hypertension, which appears without a clear medical cause and is thought to be influenced by genetic and lifestyle factors, and secondary hypertension, which arises as a symptom of another condition like kidney disease. Managing blood pressure is crucial as uncontrolled hypertension can lead to serious health issues, including stroke, heart attack, and renal failure. The traditional Chinese medicine interprets hypertension through the lens of energetic imbalances and disturbances in the body's natural harmony. Unlike Western medicine, which primarily focuses on physical factors and symptom management, TCM seeks to identify the underlying patterns of disharmony contributing to high blood pressure. These patterns are defined by an intricate assessment of bodily symptoms and signs considered through qi, or vital energy, yin and yang balance, and the state of the internal organs. Correcting these imbalances through herbal medicine, acupuncture, and lifestyle modifications is crucial to restoring health and reducing blood pressure according to TCM principles. TCM identifies several energetic patterns that may lead to hypertension. One prevalent pattern involves liver wind agitating internally, often due to liver blood deficiency or liver yang rising. This condition typically manifests with symptoms like severe dizziness, headaches, and sometimes tremors, reflecting a deep imbalance in liver function affecting the flow of blood and qi. Another common cause is qi and blood stagnation, where the life force and circulatory systems are hindered, leading to high blood pressure and associated symptoms such as chest pain and a dark complexion. These insights guide TCM practitioners in their holistic approach to treatment. The headache due to high blood pressure, the blood pressure is high, the face is red in color. We can use acupuncture on the stomach 36, the Chiao point, one swim distance below the stomach 36 point. The needle point to guide the body chi falling down. Use acupuncture on LI 11 point and use acupuncture on GB 8 point. You can also use acupuncture on the REN 12 point, mostly for front headache. Use acupuncture on liver 3 point, mostly for side headache. We use acupuncture on the UB67 point, mostly for back head pain. Use acupuncture on the shoulder pain 1 point. Thank you for your attention. Let's now go to fibromyalgia. Let's discuss acupuncture treatment for distal points. These are the points below elbows and knees that can treat problems further up along the channel. One or more of these points must always be used to treat fibromyalgia. Distal points open the channel, eliminate stagnation of qi, and help to expel pathogenic factors. They are used with reducing method and in acute cases and even method in chronic cases. Distal points are chosen according to the channel and area involved. As a general principle, the more distal along a channel a point is, the further up along the channel it extends its influence. For example, the point GB34, the Yang Lincoln point, affects the shoulder joint, while the point GB39 or Shanchong affects the neck. Of course, this is not an absolute rule because it has many exceptions. For example, the point GB41, the Zuling Chi, which is more distal to the point of GB39 of the Shuangzhong and should therefore affect an area above the neck, can affect the hip and breast. Because the distal points are by definition those below elbows and knees, it follows that in the case of wrists, fingers, ankles, and toes, there are no distal points, with few exceptions. To put it differently, in these cases, the distal and local points coincide. Distal points do not always need to be chosen from the affected channel because distal points on one channel can affect another. This applies to channels of the same polarity on upper and lower limbs, and especially the yang ones, sample the greater yang, the small intestine and bladder, the lesser yang, the triple burner and the gallbladder, and the bright yang, the large intestine and the stomach, which connect in the face area directly. One could almost look upon the yang channels of the arm and leg as one channel. This connection opens up possibilities in terms of treatment because distal points can be chosen not only on the affected channel but also on its related channel of the same polarity and opposite potential. Example is large intestine and stomach within the bright yang system. The main distal points for fibromyalgia, according to the channels, are as follows. You can use lung 7, the large intestine or LI4, the stomach is the stomach 40, the spleen is the spleen 5, the heart is the heart 5, the small intestine is the SI3, bladder is the bladder 60, the kidneys is the kidney 4, the pericardium is the P6, the triple burner is the triple burner 5, and the gallbladder is the GB41, and the liver is the liver 5. The choice of distal points must also be made on the basis of the area involved. The main distal points according to the areas are as follows. For the neck, we can use GB39, SI3, triple burner 5, triple burner 13, bladder 60, the secondary points, the stomach 40, and the kidney 4. For shoulder, it's triple burner 5, LI4, lung 7, triple burner 1, LI1, stomach 38, and bladder 58. For elbow, we can use LI4, triple burner 5, and LI1. For the wrist, we can use stomach 36, spleen 5, GB40. For fingers, there are no distal points. For lower back, we can use bladder 40, bladder 60, bladder 59, and bladder 62. For sacrum, we can use bladder 40 and bladder 58. For the hip, we can use GB41 and bladder 62. For the knee, we can use spleen 5 and SI5. For the ankle, there are no distal points. For the toes, we can use LI4. Finally, acupuncture points are chosen also according to the underlying conditions that may be dampness, Qi stagnation, blood stasis, Qi and blood deficiency. Thank you for your attention.